Do you know anyone who had a child born early? Were you born early as a preemie? Are you curious to know what causes that are out there in studies to understand what causes premature births? Different events can cause the mother to go into preterm labor and have their baby early. From personal experience, I had my child early. My OBGYN said it was due to my cervix not being able to hold the weight of the baby. But there are other causes of premature births. To this date, doctors are still unsure what causes premature births. As per the Center of Disease and Control and the March and Dimes research from July 12, 2014, there is 12.8% of U.S.-born babies that are born prematurely. 500,000 are born yearly, as well as 36% increase in premature births since the 1980s. So, what are some of the causes of preterm birth or premature births? Well, right now, the causes of premature births is still a mystery to doctors. Preterm labor can be unplanned. Here are some of the causes that could lead up to premature birth before the 37-week mark, which is the normal gestation period of pregnancy. One is carrying more than one baby, multiple pregnancies, which is like twins, triplets, or more than triplets. Another one is problems with the cervix or the uterus, which you can have an incompetent cervix, which is also called cervical insufficiency, or having a short cervix, or having chronic health problems such as diabetes and high blood pressure. Well, now that I have explained some of the complications that can cause premature births, this can give you an understanding some of what is thought to lead to premature births. So here are some of the effects that premature babies can possibly have after being born. A premature birth can lead to different medical conditions and disabilities due to the baby still hasn't fully developed, like a child born in a normal pregnancy. They can have cerebral palsy, which affects the child's ability to move and maintain posture, and they can have looseness in their arms and the chest area, and they can also have involuntary movements. Also visual problems such as retinopathy, which this causes the abnormal blood vessels to grow in the retina and the eye, which is the layer nerve tissue that helps us see. Another one is the breathing and respiratory problems, such as respiratory distress syndrome, which is caused when there's not enough surfactant produced, which in definition of surfactant is a complex occurring substance made of 6 lipids and 4 fat proteins that are produced in the lungs. Another breathing respiratory problem is apnea. And this is where the baby stops breathing for about 15 seconds or more, along with a slow heart rate or not enough oxygen reaching to the body tissues. And another one is intellectual disabilities, which is also known as mental retardation, which these can be slight, mild, or severe, and they can also lead to learning and developmental delays that can affect their speech, walking, dressing themselves, or even eat without assistance, and can affect learning in school. Also, the aftercare when the family comes home can be difficult, mentally and physically, to everyone. First thing, the baby is not able to come home a few days after birth, as in a normal pregnancy, and will sometimes have to stay in the NICU, which is a neonatal intensive care unit, for days, weeks, or even months, which can be hard on the mother not being able to do the things a mother who had her child at a normal pregnancy can do. It can also be hard on the fathers as well. Well, if needed, per doctor's orders, sometimes the parents will be sent home with a few devices. One, such as an oxygen tank, a ventilator, or a monitor. And there are many pediatric doctor appointments. I'll just name a couple because there's too many to list. Such as going to the pulmonologist, the eye doctors, and then there's the exhaustion. Because the constant feedings and the crying because the babies are still growing because they hadn't developed fully. And also the lack of sleep, because some of the preemies, they can sleep for a long time, but as a parent, you could probably lose lack of sleep because you're worried about if your child's breathing. So those are some of the obstacles families can go through in the early years, and some children outgrow these issues, but some children never outgrow their condition, and it is hard on the family. The best thing for a family of a premature baby is to have a good family and friend support. As I have discussed throughout the speech, there are many obstacles that go on before, during, and even after the birth of a premature baby. I am the mother of a premature child who was born at 27 weeks and weighed 2 pounds, 7.2 ounces, and was 14.5 inches long. And he went through the respiratory distress syndrome and apnea, trouble holding his body temperature, and he was in the NICU for 2 months. And it was very hard going home with no baby. But I had to be strong for my child and for myself. He was a fighter. He is 13 years old now, and here is my son, Hunter.